Good afternoon. My name is Joshua Nancy, and this is my collaboration and leadership reflection video for NURS 4010, Leading People, Processes, and Organizations in Interprofessional Practice. Throughout this video, I will reflect on a recent interdisciplinary collaborative experience, identifying successful outcomes and outcomes which can be improved upon, as well as analyzing how poor cooperation can lead into ineffective use of financial and human resources, reinforced with evidence from literature. Then I will cite and identify best practice leadership strategies and multidisciplinary collaboration tactics which can improve a team's capability to accomplish its goals and work together more effectively. Throughout this reflection, I will also provide 3 peer-reviewed scholarly sources to support the aforementioned topics covered in this video. To provide context, I've been a registered nurse for the past 9 years, and for the first 6 years, I did specialize in telemetry, step-down, and medical surgical units in a hospital setting. And then for the past 3 years, I've been a travel nurse working across a variety of different units. The example I will provide takes place during the first week of a new medical surgical assignment that I recently did. The patient was scheduled for an early morning discharge back to her home with ambulance transport after a failed attempt to discharge her the day prior due to unforeseen circumstances. The collaborative team members involved in the scenario are the physician, the nursing case manager, the pharmacist, the home health nurse, and myself as the inpatient bedside nurse. The patient was ordered to be on continuous TPN or total parenteral nutrition during transport and a strictly timed regimen of intravenous antibiotics by the physician. The nursing case manager then has to coordinate with the home health nurse to ensure they would be present at the house to receive the patient and immediately connect them back up to the TPN. The home health nurse also needed to be present to manage the patient's peripherally inserted central catheter, or I'm just going to call it as PICC line, and perform follow-up teaching with the patient regarding maintenance of her intravenous line. Since this scenario takes place on a weekend, it was imperative the pharmacist prepared and send a full bag of total parenteral nutrition, which I'm just going to say TPN, with the patient upon discharge and provide the first dose of IV antibiotics. The interdisciplinary collaboration started to show signs of failure when the ambulance arrived, when I realized it was only a basic life support ambulance. During handoff report to the EMT, I communicated there needed to be a nurse during transportation because it needed to infuse the antibiotics and the TPN. However, there wasn't a nurse available for the patient, and the ambulance wasn't equipped for an infusion, meaning the case manager didn't request the proper ambulance for the case. Another issue arose when the pharmacist didn't prep the antibiotics in time for departure, and the physician didn't consider appropriate timing for the next antibiotic since she was scheduled for after discharge. What helped facilitate successful collaboration was a swift and coordinated communication and decisive problem solving from all parties involved. I opened a line of communication between all disciplines at the time of the ambulance's arrival via Epic Secure Chat, and came to an agreed upon solution regarding plan of care. The solution was to administer the medication at an earlier time before discharge to avoid rescheduling the ambulance to accommodate transfusions. So this gave the pharmacy an additional 24 hours to compound future doses of the IV antibiotics, and we could just deliver to the patient's home directly, as opposed to administration during the ambulance ride. I also suggested to the physician to pause the TPN during transport and later resume via the home health nurse upon arrival, so we circumvent the issue of the wrong ambulance transportation ordered by case management. One aspect that could be improved upon is time management, as these time-sensitive alterations to the plan could have been avoided altogether. Taking the time to stop and take a practical, holistic approach to the patient's discharge planning would have decreased the number of interventions needed for transportation to actually occur. Additionally, clustering care would have eliminated the need for the additional nurse for transport, and the need to reconstitute additional doses of medication would further delay transport. Poor collaboration practices can have a detrimental effect on the resources of an interdisciplinary team, even an entire organization. Poor collaboration can result in ineffective use of a team member's time and budget, as well as increase the timeline to complete objectives. According to DeSutter et al. Study from 2019, the interprofessional collaboration results in a greater understanding of the patient, opening new avenues for approaching the patient's treatment, and ultimately produces better care. The interdisciplinary team did not collaborate in an effective manner during this scenario because they failed to assess the patient's discharge needs. They failed to order the correct type of transportation needed, knowing the patient would need a nurse to monitor the IV drips that were scheduled at the time of discharge. Additionally, there was failure to adjust the medication administration times to accommodate the patient's predetermined discharge time. Both the pharmacist and physician could have rectified this problem. There are negative implications for interdisciplinary teams, as failure to collaborate can include a prolonged hospitalization for patients, poorer patient outcomes, increased census on hospital floors, delay in home health care, and incurred costs to both the patient and organizations. As Pelanten et al. 2020 states, interprofessional collaboration may improve patient safety and health outcomes, but it also demands respect for other experts and an awareness of their various responsibilities to be successful. When discussing strategies to improve a team's ability to achieve organization objectives, McKim et al. 2023 names implicit role modeling, open communication of successes or challenges, and openness in expressing goals and aspirations as some of the techniques that can boost internal motivation. Sharing personal recounts of challenges overcome within scope of practice, along with candid expression of team expectations, can universally be applied within any organizational leadership in order to promote overall goal accomplishment. Maintaining an honest, transparent, and professional channel of communication for all team members involved would be one of the best practices in multidisciplinary collaboration. In the scenario depicted earlier, the initial stages of discharge planning could have been improved upon if communication was effectively established earlier in the day to foresee the potential delays in transfer of care. A study from Gans et al. 2024 finds healthcare professionals who state multidisciplinary communication and cooperation are critical for completing tasks successfully and consistently across multiple disciplines. Thus, maintaining a consistent and open line of communication will result in better patient outcomes, decreased length of hospital stay, and overall patient aftercare satisfaction. Okay, thank you very much.